Hi, I'm Dr. Steve Grinstead, author of the book Managing Pain and Coexisting Disorders and developer of the Addiction-Free Pain Management System. It's been an awesome week here on the East Coast. I'm at my 6th annual Addiction-Free Pain Management Center of Excellence Review with Valley Forge Medical Center and Hospital. And today I have a very special guest. So Jim, would you introduce yourself to our viewers and what you do for Valley Forge Medical Center?
Sure. Hi, I'm Jim Jones. I'm the Director of Community Relations and Development here at the hospital. And my job is to get out our treatment to the community and let them know the programs that we provide, one of them being our chronic pain program.
Okay, and so Jim, what gives you passion and motivation to keep yourself going? Why do you do what you do?
It's really the patient stories. Patients come from all walks of life, and they come into our program with a common thread, which is suffering from chronic pain. And to see them after treatment regain some of the things that they've lost because of their suffering with chronic pain, it's really rewarding.
You know, in all your travels, you go to a lot of conferences, like we're at one today. Mm-hmm. And so when you run into other programs who treat pain patients in their addiction program model, how do you see Valley Forge being different?
Well, Valley Forge incorporates both the physical and the psychological together. Most people seem to get their treatment for chronic pain from a medical provider, but they don't speak to maybe a counselor if they're going to that, and vice versa. At Valley Forge, we treat the whole patient, the biopsychosocial and spiritual, and it really makes a difference.
So what have you seen your patients experience by going through this APM Center of Excellence type model with your breakthrough program?
Well, every one of them we've seen regain their lives back and take control of their lives.
Yeah. And, you know, I heard that you guys have had a real awesome results from your post-discharge patient surveys. Mm-hmm. Can you say a little bit about what some of the things you're seeing on the surveys?
Well, what we're seeing on the surveys are people that didn't believe that they could overcome their pain, that they never thought that they could live their life without medications to control their chronic pain, mm-hmm. and their true surprise at, I guess you would say, their second life.
Their second life.
Yeah.
And so, have you seen, how long have you been there?
I've been at Valley Forge now for a little over 5 years.
So you've been there 5 years. So what has the evolution been that you've seen with this process, this program over the last 5 years?
Well, I tell you, it's really evolved as we've met the patients that come through the program, and we say, oh, we should tweak this, we should do that. But it's really evolved to our whole team has gotten together, and not just the doctors and nurses, but the counselors, the social workers, and we have an interdisciplinary team that treats these patients and really meets all their needs.
Right. So, so why do it though?
It's the outcomes. It's
for the outcomes.
Yeah, it's really to watch somebody come in and 6 weeks later walk out with hope, and they came in with none.
So from hopelessness to hope.
Yes.
You know, one of the things I call it is from surviving to thriving. Mm-hmm. And that's the awesome message I get from a lot of the people, because I hear from a lot of your patients. Mm-hmm. And it's been really empowering for me to know that someone is implementing this model, getting great outcomes, and the patients are achieving freedom from suffering.
Absolutely.
You know, I believe that freedom from suffering is every pain patient's right, but it's also their responsibility. And the Valley Forge team makes sure that the patients are active participants in their own healing process. So all I can say is thank you, Jim, and onward and upward, my friend.
Very well.
And away we go to the conference.